Thank you, everybody, for joining us for London Health Sciences Center's second monthly community update meeting. Before we begin the meeting, we're going to share a land acknowledgement from Tammy Quigley, LHSC's Vice President of Cancer, Renal, Mental Health, and Patient Flow.
It is with deep gratitude and respect that I acknowledge that London Health Sciences Centre is situated on the traditional lands of the Anishinaabeg, Haudenosaunee, Lenapewauk, and Chenungtung nations. This land is covered by the Dish with One Spoon, Covenant Wampum, and Treaty 6, the London and Township Treaty. The three Indigenous neighbours to us at London Health Sciences Centre are the Chippewas of the Thames, the Oneida of the Thames, and the Munsee Delaware Nation. As part of the Truth and Reconciliation calls to action, we have been challenged as healthcare providers to learn more about Indigenous history. I, along with my colleagues, have been participating in both in-person and virtual sessions that have helped us to really understand the atrocities that have happened, the history of colonialism, but also the wonderful pieces of Indigenous history that we bring forward as part of our learning and of our healing journey together. It is with deep.
Thank you, Tammy. For those tuning in for the first time, just to bring you up to date, these meetings are live streamed through our website and social media channels, and a recording is also made available afterwards. As we've talked about, these sessions serve as a platform to keep you informed about what's happening within our organization, to share updates on new initiatives, and to outline the steps we're taking to deliver on our promise of excellent care. This will also form the foundational structure for future LHSC Board of Directors meetings. They're going to be live streamed and available to public in published recordings. So as we reflect on the progress we've made since our first meeting in October, I want to take a moment to acknowledge the tremendous work being done by our dedicated staff and physicians, as well as some of the challenges we're currently addressing to ensure the long-term success and integrity of the organization. At our first meeting a month ago, we introduced some of the key initiatives and commitments we're focusing on during my time as supervisor. We talked about our dedication to continuing to improve patient care, fostering a positive work environment, and enhancing communication both within the hospital and with the broader community. Today, we're going to continue with those conversations, but with a special emphasis on recognizing the outstanding efforts of our staff and maintaining the trust and integrity of our hospital system. One of my responsibilities as supervisor is to address operational governance and financial issues that have taken root at LHSC over the past few years. It is not fair to our frontline team members that they have to address these topics when in public or with family and friends. They are not to blame. And when I leave, the goal is that all of these issues will be addressed so we can focus on day-to-day operations and plan for the future without the distractions of the past. One of the highlights I'm really excited to share with you today is the launch of our new Team LHSC recognition program called Great Moments. When I first started at LHSC, it became apparent the frontline staff were doing amazing things for the benefit of our patients. However, it was difficult for that work to be recognized by the public or fellow team members. This program was introduced to honor the incredible dedication, compassion, and skill that our staff consistently demonstrate in delivering exceptional care to our patients and supporting each other in our purpose. We believe that every member of our team has a role in creating great moments in patient care, whether it's through a small act of kindness, an innovative solution, or just being there when someone needs their support. The program allows you as patients, families, and community members to fill out a simple web form to share messages of recognition, gratitude, and thanks to our team members. For every message we receive, the person being recognized will receive a letter and a small item of appreciation. The program is supported by our hospital foundations, the London Health Sciences Foundation, and the Children's Health Foundation, in recognition of the importance of celebrating our team members. As of today, with less than 2 weeks since starting the Great Moments program, 97 team members have been recognized. 52 of them have been recognized by community members, by you, and 45 from internal colleagues. I encourage everyone, whether you're part of the LHSC team or a member of our broader community, to nominate a team member who has made a difference. You can find more details on how to submit nominations using an easy web form on our website, or you can scan the QR code that's on the screen. Recognizing these moments of excellence is vital. It's an important opportunity for all of us to reflect on what makes LHSC such a remarkable place to work and a remarkable place to receive care. Another item I want to talk about is I want to recognize the invaluable work of our Community Advisory Committee team. Last week, the committee held its second meeting already, and I'm pleased to say that they are making significant strides in gathering input and feedback that will guide our strategic direction in coming months. Our discussion this past week focused on the rollout of the surveys the CAC prepared that are designed to gather input from not only the team LHSC, the staff members, but also the community. I'm excited to share that on behalf of the CAC, we launched these surveys today, one again for our staff and physicians and one for our community. The community survey is now online and available in several different languages, including English, French, and our top 5 most requested languages, Arabic, Spanish, Mandarin, Vietnamese, and Punjabi. The link to the survey is live on our website, and you can also follow the QR code on the screen to learn more about it. Your responses to these surveys will play a critical role in shaping the advice and recommendations of the CAC to us. This is an opportunity for you to have a voice in the direction of LHSC for long past my presence here. Your feedback will help ensure that we stay connected to the needs of both our staff and the community we serve. Please take the time to fill out the survey, as your input is not only valuable, but essential for the work of the CAC. Together, we can make sure that LHSC remains a hospital that meets the needs of everyone it serves, from patients and their families to hardworking staff and physicians who dedicate their lives to healthcare. Again, the goal is to return LHSC to the community where it belongs. I also want to take a brief moment to address the community directly on how LHSC has been working with London Police Services as they conduct an investigation into past financial practices at LHSC after we brought concerns forward. I want to assure all of you that we're hopeful this investigation will not lead to any criminal charges, but ultimately, that's why we call upon London Police Services expertise. I want to note that this process will take time, months, not days and weeks. I will try to update everyone on progress, but please respect this is a criminal investigation and I'm limited in what I can say during the investigation. As I've shared as supervisor, it's my responsibility to ensure that all concerns are thoroughly addressed so that when I step away from my role, LHSC can focus squarely on the day-to-day issues that matter most to patients, families, and staff. It's important to me that we resolve these matters promptly so that we will not continue to revisit challenges from the past. That's not fair to the staff who do such incredible work every day, nor the community that depends on us. The focus should always be on the great care that we provide, the continuous improvement of our services, and the positive contributions we make to this hospital. As supervisor, I'm committed to seeing this process through and ensuring we can all move forward with confidence in the work we do and the values we uphold. Now, looking ahead, we want to continue to address the issues at hand and move forward with our vision for LHSC. I'm confident that the changes we are making will lay the foundation for a brighter future. We always remain focused on ensuring high standards of care, improving communication, and fostering a work environment that supports and recognizes the contributions of every member of our team. Thank you to our community for your ongoing commitment to LHSC. We won't let you down, and we remain committed to creating more great memories and moments for you and this community every day. Now, I have the honor of introducing our next set of presenters. These are senior administrative and physician leaders of LHSC who will be sharing information on various programs and services of LHSC, their history, present, and exciting future. As shared, this transparent format will be the format that will be used for future board meetings. If you cannot view the live stream immediately, it will be shared on the LHSC website, on social media, and with frontline team members. The last community update not only had hundreds of folks viewing it in real time, but we also have close to 600 views since being published. I'm going to now hand it off to Deborah Wiseman, the corporate nursing executive, and Dr. Christine McDonald, the head of the emergency departments and vice chair of the LHSC Medical Advisory Committee. Deborah, Christine.
Thanks, David. This is an opportunity for us to report to you on our respiratory season updates. Next slide. We did have a conversation last time about influenza and COVID. We'd like to advise that in order to protect our yourselves and our community, that vaccination is an excellent opportunity for that protection. With a COVID vaccination, we see research suggesting that our hospitalization rates can be reduced by 60 to 70%. As you come into our hospitals, want you to know that our physicians, staff, and affiliates are having the opportunity for vaccinations within our staffing programming, as well as we're offering vaccinations for some of our at-risk populations. For those in the community seeking vaccinations, you can go to your local pharmacies across London and Middlesex for these if you are above the age of 2. If you are under the age of 2, we've left a phone number here online for you to connect with the Middlesex London Health Unit and book time with a public health nurse. Next slide. We've changed the masking requirements at LHSC. This is also in support of keeping both those arriving to our hospital who are unwell, as well as our staff, physicians, and affiliates well in being able to maintain coming to work every day. Those staff and physicians and our learners are required to mask for all direct patient care contact. We strongly encourage all of our patients to also mask when receiving direct care from these providers, and also including our wait rooms. Patients who have respiratory symptoms, we're asking you to absolutely mask in all of our clinical and non-clinical settings, except if you're in your own inpatient room or bed space and not receiving direct patient care. We do have masks available at each and every one of our entrances. And thank you for masking. Christy?
Thanks, Deborah. Many of us will have experienced family members or ourselves with walking pneumonia. Cases of this are on the rise. It often feels like just a simple chest cold. And anytime anyone gets sick, wise to stay home for a few days and look after yourselves with good eating, good sleeping. Some of the symptoms that patients are experiencing are sore throats, headaches, coughing, fever, and fatigue. Usually children under 5 might present a little bit differently and have symptoms that are not quite as specific, including diarrhea, some sneezing, and some runny noses and sore throats. Time to be concerned and when to seek help if you've had a fever for over 5 days, or if the symptoms are lasting longer than you would think. You're fatigued for a longer period of time. 3 weeks is often a good indicator. If you're experiencing shortness of breath or concern, please seek medical help. And again, as Deborah had said, vaccination works well, masking works well, and certainly hand washing works very well. Next slide, please. With that, we'll change gears to talk a little bit about LHSC and our role as an academic hospital here in London. Next slide, please. So LHSC has a unique role, certainly a unique role within Southwestern Ontario and across the province. We are unique in that we provide the community hospital aspect to our entire community of London and surrounding area. But we are one of the largest research-intensive acute care teaching hospitals within the province and only one of 4 specialized children's hospitals in Ontario. This means that we have pillars of excellence. Not only is our highly specialized care highly valuable to our community and our province, things like cancer care, specialized surgeries, transplants, neurologic care, our cardiac care, but we also conduct leading research, very leading edge research that gives us opportunities to understand disease and make progress in disease treatment. We have clinical trials that are run through LHSC, our research institute, coined LHSC-RI. Our third pillar, so thinking clinical research, our third pillar is training tomorrow's healthcare providers. We have an extensive array of healthcare providers. We have residents, nurses, physiotherapists, occupational therapists, nutritionists, and a number of other professionals that are being trained within the walls of our institution. This allows us to innovate and provide wonderful care to our patients in our community. Next slide, please. Our teaching mandate at a glance. We have multiple affiliations, certainly with Western. We have multiple affiliations, but considering training places like Fanshawe College, we have learning agreements with over 34 institutions. In 23 and 24, we trained 4,234 learners across our institution. We do an excellent job at this and certainly welcome learners across all sectors within our 4 walls. With that, I will hand it over to Dr. Kevin Chan, Vice President, Medicine, Research and Academics.
Hello. I'm not sure. Okay. My name is Dr. Kevin Chan. I'm the VP of Medicine, Research and Academics, and I'm here to talk to you about the London Health Science Centre Research Institute. Next slide. As many of you may have heard in the media, we officially launched the London Health Science Centre Research Institute, or LHSC-RI, on October 16th, 2024. The event featured a joint launch alongside our partners at Austin Research Institute at St. Joseph's, as well as a public open house event to showcase research across Victoria Hospital, University Hospital, and Children's Hospital. Next slide. LHSC-RI is one of the top hospital-based research institutes throughout Canada. Our research is really conducted to deliver everything from benchtop science to clinical trials. And our teams are leaders in advancing and understanding really the diagnosis and treatment of diseases through research. We collaborate closely with our partners at Western University, Lawson Research Institute at St. Joseph's, and really research partners right around the world. If you think about it, LHSC-RI and Lawson Research Institute actually attracts close to $150 million in research every year. Next slide. We have a whole bunch of very different specialities. This is just a smattering of the research that is done here at LHSC-RI in many, many different arenas. Next slide. When you think about it, we are doing close to 2,800 active clinical research projects, 2,800. Many of them clinical trials that affect you really on a daily basis. The benefits include new diagnoses and treatments, really contributing and adding to the science and advancing patient care and gaining really additional support from clinical research teams. Many of you will be asked if you're a patient, are you interested in participating in a clinical trial? And this really is a personal choice. It's important for you to understand all the benefits of participating in the trial, as well as the risk, and really the specific considerations of that trial itself. So if you have this opportunity, talk to your LHSC care provider if you're really interested in learning more about clinical trials, especially in areas of disease that may be specific to your own care. Next slide. We are transforming care through research. So here are 3 of our very esteemed scientists, everything from psychiatry to pediatric neurology to oncology. Next slide. LHSC-RI, I just want to highlight two very specific areas. One is an incredible epigenetics program in the Respiratory Clinical Genome Center. And what it is our teams really combine studies of human genome, use artificial intelligence to diagnose really rare diseases. And so there is this incredible research team here that is working on that, and are world leaders in clinical genomics and actually the ability to diagnose rare disease. LHSC-RI also has an incredibly robust and groundbreaking cancer research program aligned to the Verspeten Family Cancer Center here at LHSC. Recently, we shared that we were able to treat a patient with something known as a neuroendocrine tumor using a very new theranostics treatment, which actually combines medical imaging and therapy. And this is research that is first in the world, and that's the exciting things that we do here at LHSC-RI. Next slide. So what is the future of research here at LHSC? I think we're really here on a mission to strengthen research by better aligning our research to our special care programs, integrating research with clinical care, and really offering you, the patient, more opportunities to participate in research. And we will continue to collaborate closely with our partners here in London, at Western and the St. Joe's, right across the country and around the world. Next slide. Thank you very much. And I'm going to introduce Tanya Testa, who is the Vice President of Communications and Community Patient and Client Engagement, and Karen Connors, who is the Director of Patient Experience and Volunteer Services.
Thanks, Kevin. Good afternoon, everyone. My name is Tanya Testa, as Dr. Chan noted, and I'm really pleased to be joined by my colleague, Karen Connors, who's the Director of Patient Experience and Volunteer Services. And today what we want you to know is that patient experience is more than just taking calls from you and your family. It's actually about so much more. So today we'll be providing an overview of what that means, the legislation, how we engage, how we collect feedback from all of you. Karen, over to you.
Hello, everyone. It is really an honor to be able to be here today and talk about the work that we do in patient experience. It is work I'm incredibly passionate about, and I think one of the best parts of my job here is I get to share that passion with a really wonderful team in patient experience, our patient partners who are equally passionate, and the staff, physicians, and other leaders that are all geared around how do we improve patient experience at London Health Sciences Centre. So you can go to the next slide, please. So what is patient experience? Well, patient experience embeds people-centered care principles, which really means working with patients and their families to plan, improve, and provide care that's respectful, compassionate, culturally safe, and appropriate. And one of the other pieces of people-centered care is it also takes into account what's the experience like of the staff who are providing that care, and how can we really focus on improving those relationships and processes which really drive what is a positive experience for all who are involved. On the left of that slide, you see some of the aspects of patient experience. And for sure, things like communication, getting information, shared decision-making, self-management and support, and your access to care are absolutely critical. And I think for most of us, whether you've been a patient or a family member, one of the things you always think about when you walk away from an experience is that sense of courtesy and respect and how your care was coordinated. We also look very much at culturally appropriate care and how can we learn and ensure that we're actually making improvements that make LHSC a comfortable and culturally comfortable place to be. So how do we do that? Well, we facilitate this experience by looking at the voice of patients and families and our patient partners in all of the things that we do to improve care. We look at managing concerns in a fair and confidential manner. And we look at ensuring that all forms of patient and family feedback are really used to improve quality and safety at LHSC. So I'm also going to talk in the next slides then about the various parts of the team. So that will also come up in the next slide after this one. But so why do we do some of this work? Well, one of the things is we want to be able to provide great care. But the work that we do is also grounded in some of our legislative responsibilities. So for example, the Excellent Care for All Act really outlines how all hospitals are to have a patient relations process that supports patients and families if they have concerns regarding their care. Hospitals are also to survey patients at least annually, and we are doing that more frequently than that here. And then we're to use that feedback to really inform improvements. We're also to share publicly our quality improvement plans. And one of the things I'm quite proud of is that in our quality improvement plan for last year, for example, our patient partners were quite involved in the development of what the patient experience indicator was. The other thing that helps guide some of our work is Accreditation Canada and the people-centered care standards that they set in place that they measure all hospitals against when they come in to do their accreditation processes. So they really focus on how does the hospital care for people in a way that supports their values, their needs, and their goals? And do they create a place where patients and their families work together with the hospital and the teams to take care of their health? And the hospital also look at how the hospital includes patients and families in all parts of the hospital, from making decisions about care to working on projects that help improve the hospital and being part of committees and boards. And you heard one example when I talked about our quality improvement plan about how we actually engage patient partners in helping to develop that indicator. So in patient engagement means working together with our patients and families and hospital staff to improve care. We are very, very fortunate in our patient engagement team. We have 3 staff members who are dedicated to helping hospital leaders, staff, and physicians learn more about patient engagement. And then we're also, that team helps to recruit our patient partners and provide training and opportunity for those patient partners so that they can feel connected to hospital activities and their involvement on committees and other work to help improve care. And we continue and strive every day to learn from those experiences, to get feedback about what it's like to be a patient partner here, what it's like to be a staff member who's working with a patient partner. So it's that sort of ongoing, how do we make this better? And how do we embed voice in everything we do? And to the right of that slide, you'll see a group of our patient partners and staff who were working on our Patient Experience Advisory Council last year. Next. The other part of the patient experience team is our patient relations team. And our patient relations specialists are people who are trained and listening to patients and families, understanding what their complaint or concern or their feedback might be. And they're available to our patients and families Monday to Friday, 8 to 4, and we'll work with you and the hospital team to address your concerns. All of the feedback that you would provide is shared in confidence and shared with the team with your consent. And we talk to you first about the process, obtain your consent around how we're going to share it, and then work with the team around how to address your concern. I think the other really critical piece is knowing that if you wish to have a family member, a friend, patient navigator involved in that process as your support, you simply have to let us know. And when you hear us talk about things like culturally sensitive care, that is sometimes a key place where it really matters to have someone with you who is helping you to also be present and navigate that process. We just need your consent and we'll help facilitate that. Next slide, please. Before I go on to talk about the patient experience surveys, when I think about the patient feedback that comes through our patient relations team, the goal is very much to help resolve that issue for that particular person or that particular family. But equally then, it's to also learn at what are we hearing from patients and families over time, and how do we embed that also in how we improve care here. So you're hearing sort of 3 ways. And then the third way is patient experience surveys. And last year, we launched among the largest number of surveys for any hospital in Ontario. It was last September, so it's a little over a year ago. And currently, our modality for doing surveys is by providing it in an email to patients after they're discharged from hospital. It typically will happen within a week of your discharge, either from an inpatient stay or from an outpatient clinic appointment. And if you've given us your email, you'll receive that survey. Our survey collection rates are going up all of the time. So if you're hearing this and you come in and they ask you for your email, please know that that will be the way that you would actually get a survey later on. We are also looking at establishing an oversight committee for our surveys that will include staff and physicians and patient and family partners to help monitor and evaluate how we're doing with our surveys and other ways of distributing surveys to help capture all patient and care partner voices. And what's been really exciting is since we launched last September, we've also now created a dashboard for staff and physician leadership where they're able to see their specific area results from the surveys and use that information to help guide quality improvement. So you heard me talk about, for example, the quality improvement plan that was developed with voice of our patient partners. And now the survey process is how we'll actually help monitor how are we doing around that question that was selected in the quality improvement plan. Next slide. So ways to contact us. So if you are interested or getting more information about how to be a patient partner at LHSC or want to learn more about patient engagement, our patient engagement email is there. And if you have feedback or concerns that you'd like to be able to share with the hospital, our patient relations contact information is there. And we really strive to make sure you get a response. The standard is within 5 business days, but we strive to do that much sooner than that. Aiming for same day within 48 hours to really reach out to patients, but know you will get a response. Thank you.
Thanks so much, Karen. Appreciate that very much. And we're happy to turn it over to Julia Markson, Vice President of People and Employee Experience.
Good afternoon, everybody. I wanted to take this first presentation to the community, take the opportunity to tell you about Team LHSC. So my slides, thank you, are a few graphs, and I hope they're intelligible, but we'll walk through them. Wanted to start by saying we're a really big place with thousands of highly trained, highly expert professionals who work together to provide superb care. We have over 10,000 employees, almost 1,500 physicians, dentists, and midwives. A previous presenter talked about the students. We have routinely over 4,000 students from well over 40 institutions across Ontario and the country. Sometimes we have students come from other countries as well, and well over 400 volunteers. Those employees in particular, you can see the great majority of them are full-time, and the majority of them belong to a collective agreement. So most of our employed staff are unionized, and we have 10 different union groups at LHSC. We can go to the next slide. When we talk about the distribution, the demographics of our organization, we are a young organization, and so we have everybody working here from millennials to baby boomers. But I want to draw your attention to I think they're called violin graphs, and that's on the right-hand side of the screen, the trending age distribution. And those 3 blobs look like violins, or intended to look like violins. On the left-hand side is 2014 data. The middle is 2019 data, and the right-hand side is 2024 data. So over 10 years, what you see in 2014 is we had quite a few senior staff at the top of the graph, and then less people in the middle of their careers, and then a bulge at the start of a career. As we head into 2019 and the start of the pandemic, the retirements are starting to happen. And so the baby boomers are starting to retire. You can see the graph starting to become more pear-shaped. And then 2024, we definitely have, it almost looks like a Christmas ornament. Maybe I'm thinking that way because we're getting into that season, but it's definitely a pear shape, which reflects the fact that we have a very young and vibrant staff who are developing their careers here at LHSC. And so as you can see, more than 1/3 of our employees have been here for more than 10 years. But if you look at the age distribution, you will realize that a goodly portion of our staff are indeed young and energetic and bringing new vision to LHSC. We can go to the next slide. So a lot of attention, obviously, in the media and certainly here at LHSC related to making sure that we have enough staff to provide care. And our vacancy rate has certainly dropped over the last year. That reflects improvement in vacancy rates across the province. So there was a big surge post-pandemic, and we experienced that as well, but we are seeing a drop, likely related here at LHSC to the fact that we are working on our financial health and therefore have been very, very vigorous in considering whether we need to hire more people in order for us to be accountable related to our finances. We also, as has already been talked about, we also benefit from the fact that we have such a strong health education ecosphere here in London. So lots and lots of programs, both at Fanshawe and at Western and beyond. And they ensure that we've got a really strong pipeline of talent. And so we have seen a drop in our vacancy rate. You can see that we are well below the Ontario Hospital Association vacancy rate of 7.9%. We're at 3.7%. When you look, though, at some of the roles, you can see that there are some roles that we're still struggling with. So at the top right now is clinical informatics specialist, and you're going to hear why we have that, because the next presenter is going to talk about our information technology program and project. You can see that we are, like many places, struggling to attract nurse practitioners, respiratory therapists, radiation therapists, and you can see the list. So we have very many different roles, and some of them are well staffed right now, and some others you can see vacancies where we are still recruiting. We can go to the next slide. Again, we're concerned about retention, and so we look at turnover rate. And our pattern reflects the pattern of hospitals across Ontario and certainly across Canada, in that we had a significant upswing in turnover of staff during the pandemic. And so you can see that we topped out with, a turnover rate of almost 17% in the middle of 2022, and that it has come steadily down. And so currently our turnover rate is just under 9%, which we're pleased with because it's better than the provincial number. We'd certainly like it to be even lower than that. And the turnover rate reflects both people resigning to move to different roles and retirements. And we certainly have been focused on wellness initiatives and making sure that we are negotiating with our unions appropriately and with non-union staff to ensure that people feel adequately rewarded and looked after at LHSC. We can go to the next slide. Again, these are graphs that tell a story related to the pandemic, and I think all of us perhaps would prefer not to remember the pandemic, but certainly it was really tough on healthcare. And so you can see on the left-hand side, our sick days per full-time employee really climbed during the pandemic, partially related to the fact that people had COVID. Many of our staff got COVID and had to be off sick. And also the overall stress of the situation and looking after a population that was suffering a pandemic as well. We're pleased that sick time has dropped. You can see it's creeping back up a little bit. We're pretty much the same as the provincial average from the Ontario Hospital Association, obviously still high. And we are working on what do we need to do to keep our staff healthy and coming to work regularly. And the same is true of the overtime rate, and those two rates relate to each other. Hopefully it makes sense that if we have a high sick rate, then sometimes in a place that has to continue to run, we end up paying overtime to get people in to cover sick time. And so you can see, again, during the pandemic, our overtime rate peaking and then slowly but surely coming down. And again, we are below the Ontario Hospital Association benchmark and still working on trying to reduce overtime, largely because we want a healthy workforce, and we know that too much overtime can certainly compromise people's both emotional and physical well-being. We can go to the next slide. I think actually that was the end of my slides, and I am pleased to hand it over to Nick Flaholius and Andrew Mess and Dr. Frank Mislik, who are going to talk about information technology and our big project related to a digital healthcare record.
Thank you very much, Julia. This is a great opportunity for us to showcase the work that ITS does, not just here at London Health Sciences Centre, but across the region. I have some friends here to help me out. So Andrew Mess, who's our Corporate Information Officer, and Dr. Frank Mislik, who's our Digital Physician Lead. So I am going to hand it over to Andrew Mess first.
Thanks so much, Nick, and thanks everybody for the opportunity to present to the community today. Before I get into my slides, I just wanted to share a little bit generally about ITS. So I have the privilege of leading a rather large team that includes administrative and physician leaders, technical experts, project managers, and clinical informatics specialists, as Julia mentioned previously. We support everything for LHSC and some of our partners, everything from network and telecommunications to cybersecurity, our corporate applications, data analytics and integration of data, as well as the clinical systems that I'm going to talk about today. Next slide, please. Rather than go into sort of a broader discussion around all the things that ITS does, I wanted to focus very specifically on our electronic health record. And you might refer to this, you might hear this referred to as a health information system, electronic medical record. It goes by a bunch of different acronyms. You'll find if you deal with healthcare for any period of time, you'll be inundated with acronyms. I'll try not to throw too many at you. But for today, I wanted to talk about, as I said, our electronic health record. We've called it OneChart, so that's the name that we've given it. And our team manages that on behalf of a number of partners. I'll get into a little bit of that in a moment. But it's important to understand that that record, that electronic record, your patient record, is not just comprised of LHSC information, but specifically LHSC, St. Joe's, Woodstock Hospital, St. Thomas, among a number of other smaller community hospitals. It is one of the single largest databases of personal health information in the province. And again, we maintain that on behalf of a number of partners across our local geography. It includes everything from laboratory information, medications, all of the notes that your clinical team would take about you, all of the referrals that exist in the system. It is a comprehensive, or as comprehensive a record as we can make it. When we talk about OneChart Phase 2, so that's specific to the project that Julia referenced. So it is I think it's fair to say a multi-million-dollar, multi-year project to continue digitizing the information in people's healthcare records. So it may or may not surprise some of you to know that some of your information still exists on paper. Our efforts with OneChart Phase 2 are to ensure that all of that paper, all of that pen and paper information becomes digitized so that our healthcare providers can interact with it, but also so that it can be shared with you and with other members of the care team that may sit outside of LHSC. Can we go to the next slide, please? These are the partners that I referenced previously. These are all organizations that are participating in our OneChart Phase 2 project. They're all contributing financially, with human resources, with guidance as to the project. They have very large teams within their hospitals that are helping us to move the initiative forward. And then the core project team resides within London Health Sciences Centre. So we help lead that on behalf of, as I said, all of our partners. We leverage, it's an Oracle platform, so you may hear Oracle. Cerner previously is a name you might be familiar with. And there are really two major vendors in the space globally. Oracle is one of them, and that's who we've partnered with to roll out our electronic health record, or I should say the remainder of our electronic health record. The vast majority of information is already held digitally within that database. I'm going to pass things over to Dr. Frank Mislik. Frank's an ER doc and also one of our physician leads for OneChart Phase 2, and he's going to talk about some very specific functionality within the system.
Perfect. Thanks, Andrew. So as Andrew and Nick mentioned, I'm an actively practicing emerge physician. So you'll see me at Vic and UH and even some of the surrounding regions. And I've been active in helping digitize our health records. And I think I can see the real-time impact going into a shift and then working with this team. Two of the biggest ones, I think, which are really impactful to the community is actually the MyCare portal. So this isn't so much a novel thing. It's something that's happening across other hospitals, US and Canada, but it's the ability for patients to actually have a look into their own health records. Where we start with is the ability to give them the look at their laboratory, their radiology, and even certain notes like their discharge summaries from the hospital. And I think that's really important. It gives them that transparency about where their healthcare is, but also a better platform to actually feel like they have a bit more control about it. And this not only impacts the patients themselves, they can designate family members, they have a better insight what their next steps are from the hospital, especially if they actually have a bit more of an electronic component to it rather than a paper one that's physically handed to them, which I think we all know can get very lost very easily. But on the flip side, that also changes things for us as providers. That lets us know that patients have that ability. We can use that as a communication tool and piece, have a little bit more trust and help with that health literacy. That's something that's actively being worked on here, is going to be rolled out in 2025. That also not only is where we start, but it actually has that platform to leverage further things. For example, this care portal in the future can act as a communication tool between team members and patients and their families. And I think that's really impactful. And that's only the tip of the iceberg there. But to kind of bridge and go after that, as Andrew mentioned, we're still somewhat paper in some ways, right? So to try and get fully electronic, there's always a bit of a nuance to say, well, how do we not decrease efficiency so patients don't suffer by any standard, but rather help clinicians like myself actually adopt that technology piece? So one of the big ones is called Dragon Medical One, or DEMO for short. And basically it's a frontline dictation, the same way you would think about Siri on your phone, for example, using, it takes your voice, turns it into words, but that's hugely impactful, actually seeing the real-time dictation in front of us. And we actually pair that quite well with a lot of other things like templates, and that allows us to build these complex notes that actually feed back into that kind of overarching goal of transparency, right? So all those organizations you just saw presented before, if you end up at any one of them, those notes are directly visible, and that's quite powerful. Not only that, if we start to get everything online, that's actually transmitted to the community, whether that's your primary care clinicians, nurse practitioners, or other community centers that we designate. So getting online has a huge impact, but it really lets us, I think, transmit the right information we need to patients and actually communicates better amongst us as providers. Next slide. And these are just some of the other parts of the phase 2 that's actually been done. So we've worked on anesthesia expansion and mental health, which are hugely impactful in the operating room and obviously across our community. You can see all the different hospitals there, how many staff are educated, getting them with that online adoption and other pieces. On top of that, we've actually got patient education too. We've got over 11,000 content items published, which are actually peer reviewed and reviewed by patients as well, to that actually fit well to the patient population, that health literacy that we talked about. That way, when you actually leave the hospital, you have a better idea of what happened, what it is you need to treat, and understanding medications. And that ties directly back into that portal we chatted about. So you can actually have access to all that online, and we actually standardize it across the organizations. We already spoke about Dragon Medical One as well, but just look at how many providers we've actually got using it. And that's, again, only in the mental health and the emerge so far. So it's going to continue to expand. And another really cool piece is the camera capture. So we've got these go live events that have already occurred, but the idea is that you can use a phone. So that could be a provider like myself who takes a picture, not to live on the device, but actually link it to your electronic medical record. So an image of something, whether that's a rash, a wound, an infection, and rather than using words to describe it, because pictures are worth 1,000 words, it's the same way that if you send a text of something to someone, that image actually will live in the record and actually be able to integrate into the electronic notes, which can be shared as well. So it really helps, I think, with us communicating amongst each other. But these are all the different tools that I think I'm excited about. It has a huge impact that I can see directly if you were to come into the hospital now. So I'm going to throw it back to Andrew to finish things off.
Thanks, Frank. Really well done. I asked for this slide to be included because I wanted to make a couple of points, not the least of which, because I think it's important to the community to understand how the hospital is making effective use of the resources that we're entrusted with. As I mentioned at the outset, this is a very large, very expensive project, and it's important to us that we're able to demonstrate progress along the way, not just for our clinicians and our patients, but for interested community members to understand that we're actually spending the money we're entrusted with wisely. I talked about OneChart Phase 2 as being one large project. It's actually 17 or more projects combined into one. We track them all separately so that we can ensure that we're being successful for each of those deliverables. And then we ensure that as we go live, we're capturing metrics to make sure that we're driving quality for our organization and for our patients, not just implementing bright, shiny objects, but rather trying to make sure that the things that we put in place are there to benefit patients. As Frank noted, we have a number of project streams, if you will, that have already completed. We have 3 that are set to kick off. They're just shy of 400 project team members. That's across LHSC and our regional partners. And already just within our ITS team, a little over 35,000 hours have been dedicated to the project already. And we still have another 12 to 14 months to go. So a lot of work, a lot of really good things being delivered, and still a journey that we're embarking on. The last thing I'll leave you with, and Frank touched on this, and I was remiss earlier for not mentioning it, but when we talk about all of the partners that participate with us, it's important to understand as a patient, your information is now viewable by all of those institutions. So as an example, if you live in St. Thomas, but have had to come to London for specialty care, whether that's at LHSC or perhaps with our academic partner at St. Joe's, when you return to St. Thomas and go to St. Thomas Elgin General, maybe you have to go to the Emerge, all of that information, all of your healthcare record from London follows you there. It all resides within the same database, and that's critically important for your care team. They don't find themselves calling other hospitals or chasing down records or trying to understand what your care delivery has looked like at other institutions. It's all resident within that same chart. That's valuable from a care perspective and helps us to try and drive quality. The other piece that we're working on that doesn't show in these slides is our connectivity across the remainder of the province. And we're doing that as well, making sure that we're pulling in information from long-term care facilities, other Oracle Health hospitals that have a similar record to ours. We're bringing all that information together within a single electronic health record. Again, so as patients, you can have access to it, but also so that our care team can interact with it and make sure they're doing the best thing for your care. And at that point, I think I'm passing it back to Deb Wiseman and to Dr. Christy McDonald.
Great. Thanks very much, Andrew and Nick and Frank. Excellent presentation. Certainly lots of excellent work going on across the organization. Deborah and I will talk a little bit about emergency services and critical care. I will take the emergency services piece of it. So next slide, please. Our emergency departments are exceedingly busy across the city. You'll see we have over 125,000 patient visits per year in our EDs. Our volumes continue to climb, and certainly we love to see our patients and love to provide that care. I can hear a number of phones going off in the background. I think we're all getting the alert. I can hear them going off in the hallway. One thing that we're really proud of in our emergency departments is we've done very good dedicated work to ensure that our ambulances are returning back to our community in order to provide that care that we need in our community. Our ambulances return to the streets within 30 minutes, and we take great pride in that work that we've done. Many of you will have come to our emergency departments and have experienced different degrees of wait times. Our average time for a patient to see a physician is about 3 hours. Everyone will know that once a patient presents to the ED, we are triaged by very skilled nurses who assess patients and how quickly they need to be seen. So those with higher acuity or higher degrees of sickness are seen immediately and will be brought to the appropriate care spot. Unfortunately, some of our waits are longer than we would choose, and you may be waiting 8, 9 hours for things that are less acute. However, our nurses are available and are assessing patients ongoing, even with those long wait times. Next slide, please. A few things if you are coming to the emergency department to be aware of. I don't know. Can we go to the next slide, please? Great, thanks very much. So a few things to bring with you: your health card, your family doctor, the name of your family doctor, up-to-date medication lists, and any medications in their original bottles is very helpful as we see and assess our patients. Also beware of your allergies and be able to tell us so we are able to provide the right care to you at the right time. Insurance information is also important. If you are going to be here a prolonged time or a family member or care provider is with you, please bring a small amount of money in the event that you do need to buy some food or drink. We often recommend that our patients not eat or drink prior to being assessed, just in the event that we, if you're having a complaint such as abdominal pain, that food may aggravate that. You may need to bring some activity with you, whether it's an iPad, a book, a magazine, Sudoku, whatever your choice may be. And also bring a loved one with you or a care partner. We all need advocates as we seek care and as we provide care, both in listening to the history that's taken on initial arrival as well as on discharge. So we'll go to the next slide. Before you leave the emergency department, things to consider and things to request of us as physicians and nurses is make sure we've told you what the care plan is. And if you do have questions, please ask. We know that the more questions you ask, and some patients often joke, well, Dr. Google says this, this, and this. It's actually very helpful to know what Dr. Google did say so we can talk about it and ensure that you understand the disease and that we understand you and the concerns. We also would like to share what to expect in the next few days and then when to return to the ED. Things to consider: often patients leave our EDs with prescriptions. Please consider visiting our LHSC pharmacies, both at University Hospital and at Victoria Hospital. Our hospital does own the pharmacy and support certainly benefits patient care. The pharmacy hours are as listed. With that, I will hand it over to Deborah in critical care, please.
Thanks, Dr. McDonald. The critical care program at London Health Sciences Centre exists both in the adult framing as well as our children's hospital. Individuals in our community and beyond who have surgical procedures or other types of procedures may require critical care afterwards. Additionally, individuals who are experiencing a health illness that may be becoming more complex. And finally, those with serious health injuries or life-threatening health conditions do require time sometimes in the critical care departments. These departments are usually isolated and independent units from other areas, specialty built out, and certainly accommodate a number of different requirements for the care that we serve in those areas. And a specialty trained team operates this care 24 hours, 7 days a week. Patients may experience a high level of machines, equipments, and device utilization in these areas. We use these devices to help closely monitor their conditions and also enable us to deliver specialized medications, specialized treatments, specialized interventions while you're receiving critical care. Next slide. I will share that our critical care program at Victoria Hospital has a 35-bed adult unit. At University Hospital has a 41-bed unit broken up into two, a medical surgical unit as well as a cardiac surgical unit. We see approximately 9,000 admissions to these beds annually. We do have a children's program as well, which we will present at a later date, and they see approximately 2,000 patients per annum as well. Patients who come into our critical care program come to us locally, so those that live in London, Middlesex, but they also come to us from the region as well. Because we offer specialized services at the quaternary level. So while we've got partners in our region, Woodstock, St. Thomas, Elgin General, Stratford, as a few examples, that have critical care programs as well, we do offer regional quaternary programming at London Health Sciences Centre. So the highest level of care available exists here. Things like trauma, medical surgical needs are addressed, obstetrics, which is labor and delivery. Our transplant program offers critical care services, neurological sciences, which includes things like the stroke program or neurosurgical programming, as well as critical injury recovery programs and our cardiac surgery programs. Critical care is largely a system of care. It operates with oversight from a call system called Critical, where regional team members that are seeking critical care at the quaternary level can engage with this call system. It identifies an opportunity to link with London Health Sciences Centre as an example and the critical care team. And then we can talk and speak more about transfers if necessary, consultation if necessary for any of these specialized services. Next slide, please. So these transfers from the region, you may be a patient in Bluewater Health, you may be a patient in Stratford, you may be as far away as Owen Sound, and as well, even past these regularly referring hospitals, we do receive patients from the region and beyond. That is because of the higher level of care that we offer. And the goal of the care in this area is that we would service your critical care needs and then return you back to your referring hospital as soon as you're well enough to be transported back. It supports you being closer to your family and friends as you continue your recovery. Those ICU admissions that come from sort of outside our London Middlesex area account for about 525 patients per year. Next slide. What you can expect if you're visiting someone who is a critical ill patient in our area is that the recognition from our team that this is a stressful environment. It can be often intimidating, and having someone, a family member, a loved one, a friend in our critical care area requiring that high level of support certainly adds an additional anxiety and stress as you arrive to our units. The admitted individuals, so at the time of admission, recognize that we would ask a little bit of patience while we work to stabilize that individual, make sure all of their care needs are met, and that the team is comfortable and confident that they are in a position whereby visitors can then come in. Visiting hours in our units are very flexible. And certainly we work with our family members, our caregivers, and our friends to accommodate those special needs as it relates to the ability of the patient's health and wellness to accommodate that. So at times we may ask you to limit your visitors, we may ask you to limit your visiting time, and that is all in the interest of the patient and their care needs. And at times we may ask you to step out while the care teams are involved, engaged in assessing, treating, intervening with your patient's needs. Next slide. And back over to David to close out the community update meeting.
Thank you, Deborah and Dr. McDonald. So in our last meeting, we shared a web form for you to submit questions, and we're doing the same today. You can find the link in the description on the YouTube and on our community update meeting page of our website. We also have a QR code up on the screen for you to scan. It'll take you to the form to submit questions. So I just want to take a few minutes before closing today to address the questions we received after the last meeting, and we've themed some together to get through as many as possible. So we received a couple questions about patient and caregiver representation and what that looks like for both the Community Advisory Committee and more broadly across our organization. I want to start by saying that the CAC includes one of our patient partners from LHSC, and also other members of the CAC bring very valuable perspectives as to patients and caregivers. Their involvement ensures that the voices of patient and caregivers are directly representative in our planning for the future. We know that having patient experience and caregiver involvement strengthens our approach to care and decision-making, which is why we formed the CAC to include a very diverse group of Londoners. In addition, as stated, the CAC is seeking input from the entire community to inform their planning through the surveys I shared earlier. As Tanya and Karen shared earlier today, we also have patient partners who sit on committees across our organization and contribute to our planning and decision-making. That critical work is still ongoing during my appointment as supervisor. They are core members of the team who help embed the patient voice in our work. I also want to note that we received some specific pieces of feedback related to patient experiences at LHSC through the question form. As we have kept this form anonymous, we're unable to follow up specifically with those folks. However, I would encourage anyone with feedback to contact our patient relations team at that email, patient relations with an S at lhsc.on.ca, or phone 519-685-8500 at extension 58230. We received also a question about making these sessions more accessible, both ensuring presentations are delivered in plain language, not in scientific language, and that we consider offering them in French. Our team presenting today has tried to stay away from any medical and scientific speak. We also actively working with our organization to find solutions to make these sessions more accessible to the diverse community we serve. We appreciate your input as we work towards enhancing the experience of everyone in our community. And I thought it was amazing that Dr. McDonald, right when she was talking about emergency services, the emergency warning came out overhead. Amazing timing, Dr. McDonald. We also received a question about accessing healthcare in French. We recognize that access to care in patients' native languages and Canada's official languages is essential for our community. And at LHSC, we're dedicated to ensuring that every patient feels confident in understanding the information provided by their healthcare team. If you or someone you know needs an interpreter for a visit, we encourage you to inform your family physician secretary or the medical secretary of your LHSC physician. We will arrange a professional interpreter at no cost who will confirm details with you before your appointment. Now, we received a couple questions about how to contact LHSC senior leadership team to share any concerns. Our patient relations team is the main point of contact for patient feedback at LHSC. And what they do is they'll work to make sure any concerns they get are connected with the right leaders across the organization that include myself. This helps us respond effectively while keeping senior leadership aware of the concerns. Now, if you're looking for a more direct line, you can find me. You can find me. The email is officeofthesupervisor@lhsc.on.ca, which is on the LHSC website, along with my cell phone, which is 519-870-2999. Again, 519-870-2999. Many of you have contacted me, and I've had the pleasure of being able to talk to many of you as well. And finally, we received a question regarding staffing shortages in CT and ultrasound imaging. Unfortunately, there is a shortage of medical radiation technologies across the province and elsewhere. Here at LHSC, we've been very proactive in our recruitment efforts, including a national recruitment campaign, active participation in recruitment fairs, increasing as many clinical placements for students as we can, and supporting even high school cooperative programs. In both CT and ultrasound, we've added extra shifts to help meet the growing demand, and we're also cross-training staff in CT to build a larger pool of skilled team members. Specifically in ultrasound, our internal clinical demand and staffing pressures limit our ability to accept external referrals. To ensure that we meet the needs of our most urgent and acutely ill patients are met, we do this with our medical imaging team, who triages all exams and prioritizes them based on clinical urgency. However, your provider will ensure you're referred to the most appropriate setting for your ultrasound needs. So again, thank you everyone for submitting your questions. I look forward to answering more in our next meeting. And really, I want to thank everyone who tuned in. I hope you're finding these meetings valuable. In closing, again, I would like to encourage you to fill out those community surveys. This is your chance to provide feedback and help us build a stronger future for LHSC as we improve our operations. Again, the link is on our website. To our media partners, please join us for our media scrum. We look forward to addressing any questions you might have. I hope everyone has a great day today. Take care.